Jennifer Fowler, University of Louisville. And I am in here with my supervisor and director, Ashley Caldwell, who's given me permission to videotape this.
Yes.
Okay. All right. Today I wanted to propose that we expand some of our programming. I know when we talk about our mission here, we talk about providing a great experience in our mental health counseling, and we talk about individual and family functioning and how to improve that. But our very last sentence of our philosophy talks about this every step of the way. And when I think about that, and when I think about our program, I think about carrying mental health services through an entire process. And when we talk about adolescent drug treatment, that process could start at inpatient, and they could go to intensive outpatient, and then into our services like the adolescent outpatient treatment, the less intensive, and our group therapy. But we are missing a component. And I know this agency does so much to try to build up our Medicaid population and try to service our community, not just what we do with our private insurance clients. Mm-hmm. We provide sliding fee scales, assessments for family court, drug analysis for our CDWs that's directly related to our adolescents. We are a model court. We're represented on teen court, not the countless committees that you and I are on that are dedicated to this, with people in poverty and people dealing with family issues and family preservation. So I think that kind of going back to every step of the way, instead of just providing this less intensive services in our community, mm-hmm. I think that we can really benefit from our newly acquired Medicaid status, which I know that this agency is so happy to have. But now we're looking at how do we grow the agency, how do we create those programs, how do we fund those programs, and how do we make sure that it is along with our philosophy and our mission. One of the big deals is reimbursement. How do you do this? How do you create programs for people that you don't really, that you don't want to have any add-on costs besides whatever their insurance may be. Right. And we've had to use our private insurance population to kind of serve, be able to provide those services. But now this new Medicaid status is really going to open that door for us. Mm-hmm. And I just got the Kids Recovery Grant. It came to us, it came to me through a supervisor with DCBS and one of the SRAs that said that they really think that myself and you and the agency would be a great place for some of these programs to exist. The Kids Recovery is $12 million to expand adolescent drug treatment programming. Mm-hmm. It's a really open door money. It's not. It's going to be a one-time allotment for 2 years. And what they want to, they just want us to kind of loosely outline to them what's going on. This money came from to the county or the state general attorney's office when they had actually filed lawsuits against the pharmaceutical companies. Mm-hmm. So this money really isn't directly tied in with all those usual grant stipulations that scare us so much, mm-hmm. right? So we wanted to look at the needs of the counties, and as you know, we only have one intensive inpatient place for adolescents and drug problems in our whole 8-county region. We have no intensive outpatient, and then we have a few people like us that'll do this less intensive outpatient and these group therapy. So I think it would be a really great opportunity for us to expand to intensive outpatient. Mm-hmm. I've looked at the Kentucky State Plan for the new Affordable Health Care Act, and I've got all those standards down, and there you have copies of exactly what that Kentucky Medicaid standard is. Yeah. I think that we can create this program that can take us into sustainability, first by using the startup money provided by the Kentucky Kids Recovery Grant, but we can start billing and creating the model according to the Medicaid and our private insurance billing status. That way, once we build up those client bases and once we get the program off the ground within the 2 years, then we'll be able to sustain this type of programming for our agency without this Kids Recovery Grant. And it really, I think what the big focus is that need of the spectrum of care and being able to provide services every step of the way. So I think that we really need to look at the data, and I've provided some of that to you from the National Institute of Health and also from SAMHSA, that all this data lends itself to being able to find outcomes in maintenance and recovery due to the spectrum of care. So we know we have intensive inpatient services, and we know we have less intensive outpatient services, but what I think could be uniquely benefiting us is that we're also able to utilize our 2 in-house CADCs. And I think in the state of Kentucky, I think there's only 15 licensed CADCs, and for us to have 2 at one agency and to be able to utilize that supervision would be wonderful. So I'm proposing that we request $100,000 for 2 years from the Kids Recovery Grant. 80% of this would go into personnel, so it would be about $20,000 to $25,000 a year for the director, who's a CADC, and then $10,000 for a supervisor, which will be our other CADC, AJ, and then probably $5,000 a year for Medicaid billing and that kind of thing. And then the rest of the $20,000 would go to the Matrix Institute supplies. I know that you've already been certified in the Matrix Institute and that model for adolescent kids recovery, but I spoke to them, and there's a $7,000 one-time fee, and we could get our entire agency staff, and that includes the kit that all materials would come from. And I've looked at it versus our private insurance billing status, and I've looked at it versus the Medicaid billing status, and I really think that we can have a really solid program that, that's evidence-based and research-based that we can use, that's also going to be congruent with us being able to fund these programs and look at sustainability. I think the matrix model allows for us also to be able to go into school, so I know that we already go and provide school-based therapy, so I feel like some of that time can be spent in that school and doing a couple of those components, maybe like the group piece and things like that. But I have all this written down for you, and if you want to look at the third folder I've given you, and it gives you all the breakdown of the budgeting, it gives you the evaluations, and it gives you the assessment, referral, and goal setting processes, and all the objectives of the program, and then it gives you all the information on the matrix model and how would we, what the actual process would be and how would we do the supervision, and then talk about, and I've outlined how we would do follow-ups and do all the data. I've created all that. So if that's something that I would hope that you'll definitely consider and take a look at. I know that it's a lot of information for just a few short minutes, but if you could take a look at that information, and maybe we can set up a time and talk next week.
I think that sounds great.
Okay. Thank you.